So, if you're expecting a baby, you already know that pregnancy comes with a whirlwind of information, a ton of appointments, and, well, a lot of tests. It can feel pretty overwhelming, right? But what if we looked at it a different way? What if all those screenings are actually just building a powerful prenatal safety net for you and your baby?
It's a question that pretty much every parent-to-be asks, and it's a fantastic one. So in this explainer, we're going to dive right in and get some clear answers. We'll build a picture of what these tests are for, why they're so important, and how they work together to protect you both.
I really want you to hold on to this idea, a protective shield. Every single test we're about to talk about is just another layer of that shield. They're all designed to catch any potential issues as early as possible, back when we can actually do something about them. It's all about being proactive.
So, what is this safety net really? Well, the number one goal of all these screenings is to spot potential health issues super early. And look, this isn't about looking for trouble, it's about creating opportunities. Opportunities for early intervention and for effective treatment.
Okay, you might hear this official sounding term, antenatal serological screening. Sounds complicated, right? But let's break it down. Antenatal just means before birth, and serological, that just has to do with things found in your blood. So really, these are just blood tests done before birth, all designed to spot things where acting early makes a huge difference.
So, where does this protective shield even begin? It all starts by making sure the foundation is strong. And that foundation, of course, is the mother's core health. At your very first appointment, you're going to have some routine blood checks. These are looking for really common issues, like anemia, by checking out your red blood cells. They'll look at key things like your vitamin D and iron levels, and they'll keep an eye on your blood sugar. This just creates a baseline of your health, and it forms that first, absolutely essential layer of the shield.
All right, so with that foundation in place, the next layer of protection is all about guarding against certain infections, ones that could potentially be passed from mother to baby. And this is where screening is just incredibly powerful.
You know what's amazing here? You can see a really clear pattern. For every one of these potential infections, from HIV to syphilis, the screening doesn't just find a problem, it unlocks a solution. It could be a treatment for the mom, a vaccine for the baby right after birth, or even a simple course of antibiotics. The knowledge from the test leads directly to a protective action. It's fantastic.
Okay, let's move on to something you've almost definitely heard of, but that can feel a little confusing. The Rh factor. This is a super important piece of that safety net, and it's all about making sure blood types are compatible.
Let's break this down because it's actually pretty simple. Most people are Rh positive. Some are Rh negative. Either way is perfectly healthy. A potential issue only comes up in one specific scenario. An Rh-negative mom is carrying an Rh-positive baby. Her immune system might see the baby's blood cells as foreign, and it could start creating antibodies to fight them off. And if those antibodies cross the placenta and start attacking the baby's red blood cells, well, that can cause a very serious type of anemia and other issues. The condition is called HDFN. And that is exactly the problem we want to avoid.
So, how do we stop it? The solution is, believe it or not, remarkably simple and effective. A blood test early in your pregnancy tells you if you're Rh negative. If you are, you get an injection called anti-D. And what this shot does is it basically tells your immune system, hey, stand down, so it never creates those harmful antibodies in the first place. This protects not just this baby, but all of your future pregnancies too. It's a perfect example of how one simple action can solve a really complex biological problem. Okay, last but not least, we've arrived at the part of screening that, let's be honest, can cause a lot of anxiety for people: genetic screens. So let's walk through this one carefully, because understanding what these tests are and what they are not is so important. So these screens, which are usually a mix of a blood test and an ultrasound, they estimate the chances of a baby having certain conditions. These can be things like chromosomal conditions. A trisomy just means there's an extra chromosome, or issues with how the spine and brain are developing. The whole point here is to give parents information to help them prepare or to make other personal health care decisions.
Now, this next point is probably the single most important thing to remember about genetic screens. I'm going to say it again. They are designed to identify pregnancies at higher risk, and they do not provide a definitive diagnosis. This distinction is absolutely crucial. A screening test cannot give you a yes or no. It only tells you if the chance of a condition is higher or lower than the average.
This chart shows the difference perfectly. Over on the left, you have the screening test. It's totally non-invasive, risk-free, it just gives you a risk estimate. Now, if that estimate comes back higher, you're then offered the choice to have a diagnostic test. That's on the right. A diagnostic test can give you a definitive yes or no answer, but since it's invasive, it does carry a very small risk. So you see, the screening test is really just a tool to help you decide if you even want to consider taking that next step.
And that really gets to the heart of everything we've talked about today. The purpose of every single one of these tests is to empower you. It's about replacing uncertainty with information so that you, along with your doctor, can make the best, most informed decisions for you and for your family.
So I want to leave you with this one final thought. Instead of getting lost in all the technical details of every test, just remember that your most powerful tool is asking good questions. And a great one to start with is this. If this screening test shows a higher risk, what are our exact next steps? Asking that simple question can open up a clear, calm conversation and turn what feels like a really complicated process into a much more manageable journey.